Let's start. Cushing syndrome. Okay, today we'll be discussing about Cushing syndrome and the Addison's disease. Coming to the Cushing syndrome. Okay, adrenal gland में क्या होता है भन्दाखेरि as you all know, it is divided into two parts. The outer one is the cortex and the inner one is medulla. We know there are right and left adrenal glands situated at the upper pole of both the kidneys. Okay, and on the transverse section, what we see is that the outer it is covered with the capsule, and the inner one is cortex and medulla. Cortex further divided into zona glomerulosa, fasciculata, and reticularis. Okay, functions are the थाहा छ होला नि है zona glomerulosa GFR formula. Zona glomerulosa releases the mineral corticoids, mostly aldosterone. It is responsible for reabsorption of water and sodium and excretion of potassium. Likewise, zona fasciculata secretes cortisol, that is glucocorticoids, that is responsible for gluconeogenesis, increasing the blood glucose and the retention of water as well. And the zona reticularis secretes this sex hormone, that is androgens. Okay, mostly dihydroepiandrosterone, and these are the sex hormone precursors, and they are responsible for maintaining the sexual characteristics. Okay, what we know is that hypothalamus releases the corticotropin releasing hormone that acts on the anterior pituitary, and this pituitary releases the ACTS hormone. This ACTS acts on the adrenal cortex. Okay, and this adrenal cortex sends an inhibitory signal to the hypothalamus. Likewise, this pituitary releases ACTS, which sends the positive signal to the adrenal cortex. Normally, यो mechanism हुन्छ है. So what happens is that in the disorder of adrenal cortex, it may be associated with either hyperfunction or hyperadrenalism or hypofunction or insufficiency, that is hypoadrenalism or the adrenocortical tumors. In the adrenal cortex, GFR, glomerulosa, fasciculata, and the reticularis, their function may either be increased or their function may be suppressed, or they may respond to by producing various tumors. Okay, in case of hyperadrenalism, what happens is that there is the excess production of one or more of the adrenal cortical steroid. Likewise, in case of Cushing syndrome, there is cortisol production, that means excess of glucocorticoid. In case of Cohen syndrome, there is excess of aldosterone. And regarding the adrenogenital syndrome, there is excess of sex steroid. Okay, so hyperadrenalism means overproduction of adrenal hormones, which may be either glucocorticoid, sex steroid, or the mineral corticoids. Okay, so coming to the Cushing syndrome, these are also called as chronic hypercortisolism. There is excess production of cortisol. Okay, this cortisol is a glucocorticoid. It is a chronic hypercortisolism, excess production of cortisol. This Cushing syndrome may be either pituitary, adrenal, ectopic, or the iatrogenic. Most common is the iatrogenic. So, what may be the cause? This may be either exogenous or the endogenous cause. Coming to the exogenous cause, when the person is habituated, when the person is habituated to take the medications as glucocorticoids for a prolonged period of time, this may lead to Cushing syndrome. Coming to the endogenous, as we know in Cushing syndrome, there is the excess production of cortisol, which may be either due to pituitary tumor, comprising 70% of the cases, followed by adrenal tumor and unknown causes, is comprising 15% of the cases. So pituitary Cushing syndrome. Okay, pituitary Cushing syndrome. What happens is that whenever there is a presence of a tumor in the anterior pituitary, okay, anterior pituitary tumor छ भने के हुन्छ? It stimulates the release of ACTH. ACTH increases, and likewise in the adrenal gland there is adrenal hyperplasia. Okay, in the adrenal Cushing syndrome, it may be either due to tumor or any other etiology which causes the increase in the secretion of cortisol, but the level of ACTH is not increased. Similarly, in case of paraneoplastic or the ectopic cause, what happens is that the other non-endocrine tumors as lung cancers, okay, lung cancers, all these tumors stimulate the release of cortisol, and also it is associated with the increase in the ACTH level. Likewise, in case of iatrogenic, when a person consumes too much of steroid, it leads to Cushing syndrome, but there is adrenal atrophy हुन्छ iatrogenic मा चाहिँ. Most case मा चाहिँ adrenal hyperplasia हुन्छ, iatrogenic मा चाहिँ adrenal atrophy हुन्छ. Okay, pituitary Cushing syndrome मैले अघि भनिसके. Whenever there is a lesion or the tumor in the pituitary gland, that may be a corticotroph tumor, corticotroph adenoma, which causes the excess production of ACTH. That is pituitary Cushing syndrome, and it is also known as Cushing's disease. Cushing syndrome र Cushing's disease is a different thing. Okay, Cushing's disease भनेको pituitary Cushing syndrome is called a Cushing's disease. Pituitary tumor ले गर्दाखेरि if it increases the secretion of ACTH, that is Cushing's disease. Okay. And it is characterized by the adrenal cortical hyperplasia with elevated ACTH. The person responds well to dexamethasone because when a high dose of dexamethasone is given, it will suppress that increased ACTH level and reduces the cortisol level. Similarly, coming to the adrenal Cushing syndrome, it may be either due to any of the cause, either adrenal cortical adenoma, carcinoma, or the cortical hyperplasia. Okay, this all lead to Cushing syndrome. Then it is adrenal Cushing syndrome, but there is a low level of serum ACTH. Now, unlike to that of the pituitary where there is high level, in case of adrenal there is low level. Coming to the ectopic cause, it is due to the non-endocrine tumors as non-small cell C of the lung or the old cell carcinoma of the lung, pancreatic tumors, and the malignant melanoma. This all lead to high ACTH level. Okay, is it clear? बुझिरहेछ अहिलेसम्म?
Yes, ma'am.
Yes, ma'am.
Okay. Coming to the iatrogenic, as already mentioned, when a person is taking steroid for a prolonged period of time, then it will lead to Cushing syndrome, mostly in case of autoimmune disease and the organ transplant recipient. Here it is characterized by adrenal atrophy or the bilateral ethnocortical insufficiency associated हुन्छ. Clinical features, what the patient present with? The patient present with the obesity, which may be central or truncal obesity, abdominal obesity. The legs and arms are thin, and in the shoulder, at the back of the shoulder, you'll see a prominent hump-like structure. That is due to the deposition of fat. As the steroid level is high, the person will have a round moon face, and also there will be a various purplish striae-like mark in the abdominal wall. The patient will have osteoporosis, and also there is the thinning of the skeletal muscles with the atrophy of the skin. Easy bruising, systemic hypertension, because here there is excess cortisol. So also there is a retention of the sodium and the water, so the person will have hypertension. Impaired glucose tolerance, because cortisol, high level of cortisol causes hyperglycemia. Okay, so the person will even develop diabetes mellitus. other features as amenorrhea, hirsutism, infertility, insomnia, depression, confusion, all of the clinical features can occur. I have mentioned the clinical features like this or in the chart form, whichever will be easy for you. You can study in that way. But better if you write with a system-wise pattern, that would be more better. The same thing as already mentioned in the body fat, in the skin, in the bone, muscles, cardiovascular system, metabolic, reproductive, CNS, and immune system. Okay, the same thing as already mentioned. You can better write in the systematic manner. Okay, the person is having a moon face. Okay, facial plethora, and this is a buffalo hump. This is a picture of a person with a Cushing's syndrome. These are the all these purpleistria. In case of the patient with the Cushing syndrome, there is a deposition of fat in the abdomen, and the arms and the legs becomes thin. Okay, purpleistria. You can even remember this picture. Okay, there is the legs are prone to fracture, osteoporosis, the obesity, even a thin arms and legs, and also this try already mentioned hyperglycemia, CNS irritability, moon face, increased susceptibility to infection, all these things. Cushing syndrome clear भयो? Is there any question regarding this?
No, ma'am.
No, ma'am.
No,
सबैले
ma'am.
बुझ्यो हो?
Yes, ma'am. Yes, ma'am.
Okay. Shall I move to another topic
Yes,
then? Okay. Coming to the adrenogenital syndrome. Okay. Adrenogenital syndrome मा चाहिँ के हुन्छ त भन्दाखेरि नर्मली के थाहा हुनुपर्छ भन्दा एड्रिनल कर्टेक्स सेक्रेट्स डिहाइड्रोएपिएन्ड्रोस्टेनिडियोस्टेरोन एन्ड द एन्ड्रोस्टेनिडियोन. ओके, एड्रिनल कर्टेक्समा चाहिँ जीएफआर रेटिकुलारिसले चाहिँ सेक्स हर्मोन सेक्रेट गर्ने हो नि त हैन. सो एड्रिनल कर्टेक्सले डिहाइड्रोएपिएन्ड्रोस्टेरोन एन्ड द एन्ड्रोस्टेरिडियोन which is secreted is converted into testosterone in the peripheral tissue. Okay, and that is utilized for various Ma'am, please राम्ररी सास फेर्दै फेर्दै पढाउनु न प्लिज. हामीलाई पनि हाई आइराछ. What happened? मैले हाई गरेर उ भयो अल्छी लाग्यो के हो?
म्याम हाम्रो क्लासको स्टुडेन्ट नै होइन, स्वस्तिमा बराजुली कोही पनि छैन.
अनि को हो यो स्वस्तिमा बराजुली?
कोही पनि छैन म्याम. त्यस्तो म्याम
के फेक आइडी?
हुनसक्छ म्याम.
ह?
फेक आइडी होला म्याम. हाम्रो ब्याचमा कोही पनि छैन स्वस्तिमा.
यो कहाँबाट आयो त? यो के कसरी ब्लक गर्न मिल्दैन यस्तो नचाहिने एड्रेसलाई?
च्याट अफ गर्दिनु न म्याम.
आस्था घिमिरे देखाइरहेछ त.
म्याम च्याट अफ गरिदिनु न सकिन्छ.
ओके, थगाइ त लगाइहाल्छ नि. यस्तो 3 देखि 4 बजे छ क्लास. Okay, in case of the adrenogenital syndrome, there is the disease is characterized by the excess of the androgen hormone. Okay, it may be due to various causes. Either there may be gonadal disorders or the adrenal disorders. There may be number of etiology, which may be either due to gonadal disorder, gonadal dysfunction or bara, या adrenal disorder सँग association छ भने that is adrenogenital syndrome. So, adrenal cause of androgen hormone excess will be either the tumors, okay, adrenocortical neoplasm or the tumors, or the congenital adrenal hyperplasia. Okay, there may be the two conditions. In case of adrenogenital syndrome, that may be associated with androgen hormone excess, which may be either a neoplasm or the tumor, and the next one is congenital adrenal hyperplasia. Mostly this adrenocortical neoplasm is associated with symptoms of hormone excess. Which hormone? Androgen hormonal excess, and are more likely to be carcinoma. Mostly the carcinoma नै हुन्छ adrenocortical neoplasm र CAH सँग associated entities fall huncha yo adrenogenital syndrome. Adrenogenital syndrome ma there may be either the dysfunction of the adrenal gland or the gonadal system, both, and there is the excess production of androgen hormone. Okay, so coming to CAH भनेर चाहिँ एउटा short note भनेर आउन सक्छ, and it is very important topic as well. Okay, this CAS is an autosomal recessive disorder, and what happens is that there is a hereditary defect of enzyme involved in the adrenal cortisol synthesis. Enzyme एउटा deficient हुन्छ, so that it will predispose to this congenital adrenal hyperplasia. कुन enzyme deficient हुन्छ? 21 hydroxylase. Okay, so when there is a decrease in cortisol, it causes the increase in ACTS level. Cortisol level घट्यो भने चाहिँ ACTS बढ्छ due to lack of feedback inhibition. किनभने त्यसलाई अपोज गर्ने कुनै पनि मेकानिजम हुँदैन, सो कर्टिसोल घट्ने बित्तिकै ACTS को प्रोडक्सन चाहिँ इन्क्रिज हुन्छ है. Most in the 90% of the cases, the 21 hydroxylase enzyme is deficient. Okay, and this why this 21 hydroxylase enzyme is deficient? What happened then? It is this 21 hydroxylase enzyme generally is required for the synthesis of mineral corticoids and glucocorticoids, but not the sex steroid. When both of these enzyme, glucocorticoids and the mineral corticoids becomes deficient. Why? Because of the deficiency of 21 hydroxylase, then whole of this mechanism becomes diverted towards the synthesis of sex hormone. Okay, पहिला चाहिँ के हुन्छ यसमा चाहिँ 21 hydroxylase enzyme को deficient हुन्छ. When this enzyme is deficient, the cortisol and mineral corticoids production is decreased, and all the pathway becomes stunted towards the secretion of sex steroid. And what happened is that generally we see the hyperplastic adrenal gland, they become enlarged. Cortex say nodular or thickened huncha. Okay, and also the cortex appears brownish due to the depletion of lipid. त्यसमा त lipid deposition गर्दा yellowish हुनुपर्ने हो नि त adrenal gland, तर यो चाहिँ brownish हुन्छ because of the lipid depletion. Similarly, there is numerous lipid laden clear cells and the eosinophilic cells. यता चाहिँ hyperplastic of adrenal gland हुन्छ भने pituitary मा पनि hyperplastic of the corticotroph cells हरु चाहिँ देखिन सक्छ in the anterior pituitary, which appears as eosinophilic cells. है यो hyperplasia of the corticotroph cells चाहिँ eosinophilic भएर देखिन्छ. अनि यसमा चाहिँ यो cortex is brownish due to lipid depletion. Generally चाहिँ yellowish देखिनु पर्छ cortex of the adrenal gland. Okay, यो बुझिरहेछ adrenogenital syndrome?
Yes, ma'am.
Okay, so what happened is that your hormone deficient this hormone is mostly associated with the production of cortisol and the mineral corticoid. When both of this enzyme is deficient, when this enzyme is deficient, then what happened? The sex steroid hormone, that is androgen, becomes hyperactivated. Okay, androgenic hormone धेरै भएपछि के हुन्छ? Female मा पनि there may be the features of masculinization as clitoral hypertrophy, or the female may present with oligomenorrhea, hirsutism, acne. Okay, and the pseudo-hermaphrodite infant may be seen at birth. Okay, when during the birth, child may be pseudo-hermaphrodite, not a true hermaphrodite, but a pseudo-hermaphrodite. And in case of the male, what happens? There may be the enlargement of the external genitalia or the precocious puberty. भनेको pubertal age पुग्नु अगाडि नै the person will have all the secondary sexual characteristics. By the age of 7 or 8 दारी जुङ्गाहरु आउन पनि हुन सक्छ भन्नु खोजेको precocious puberty. Okay, and some of the men may be fertile, or there may be the failure of the Leydig cells, and there may be oligospermia, and most of the cases the males are infertile. So infertility ko one of the cause also is congenital adrenal hyperplasia. Okay. And even the patient may present with, due to the deficiency of cortisol and mineral corticoid, there is a due to the deficiency of aldosterone, the patient may present with the salt wasting, that is the sodium wasting, and they are also at risk for adrenal insufficiency. Okay, due to cortisol deficiency, the patient may present with the adrenal crisis as well. And in any of the cases of the children with ambiguous genitalia, CAS should be suspected, because due to the deficiency of the 21 hydroxylase enzyme, they may present with even vomiting, dehydration, salt wasting, all of these life-threatening conditions. So what to do? The patient with the CAS should be treated with the supplementation of glucocorticoid. So it not only provides the adequate level of cortisol, but it also suppresses the ACTH level. Okay, because what happens is, if there is the low cortisol level, ACTH becomes hyperactivated. So in this condition, the person should be given exogenous glucocorticoid as well as mineral corticoid for this salt wasting variant, because there may be the continuous. Why there is salt wasting? Mineral corticoid deficient भएपछि के हुन्छ, सोडियम र वाटर चाहिँ लस हुन्छ हैन, पोटासियम चाहिँ बडीमा रिटेन हुन्छ. So this lead to salt wasting syndrome as well. So mineral corticoid supplementation, glucocorticoid supplementation should be done. The patient may present with the features of androgen excess, and this is the main hormone deficient in CAH is 21 hydroxylase. Is it clear?
Yes,
Your adrenogenital syndrome? के छ नबुझेको यसमा? एडिसन्स डिजिज स्टार्ट गरौँ त्यसो भए?
हुन्छ म्याम.
के छ, के बुझा छैन भने भन्ने हुन्छ, म एकचोटि फेरि बुझाइदिन्छु.
मैम एकचोटि लास्टको टपिक एकचोटि फेरि रिभाइज गराइदिनु, अलि छिटो बोल्नु.
CAH यसमा चाहिँ के छ त भन्दाखेरि पहिला एड्रिनोजेनाइटल सिन्ड्रोम भने के हो भने थाहा हुनुपर्छ. ओके, एड्रिनोजेनाइटल सिन्ड्रोममा चाहिँ एन्ड्रोजिन हर्मोनको एक्सेस हुन्छ. सो देयर मे बी एसोसिएसन विथ आइदर द गोनाडल सिम्पटम्स अर द एड्रिनल सिम्पटम्स है. अनि जनरली टेस्टोस्टेरोन केबाट बढ्छ? डिहाइड्रो एपिएन्ड्रोस्टेरोन र एन्ड्रोस्टेरोनबाट. तर त्यो टेस्टोस्टेरोनको चाहिँ पेरिफेरल टिस्युहरूले चाहिँ प्रपर युटिलाइजेसन चाहिँ गर्नुपर्छ है. तर यो एड्रिनोजेनाइटल सिन्ड्रोममा चाहिँ के हुन्छ त भन्दाखेरि आइदर दिस सिन्ड्रोम इज एसोसिएटेड विथ ट्युमर्स अर द कन्जेनाइटल एड्रिनल हाइपरप्लेसिया है. ट्युमर्सहरू भयो भने चाहिँ दिस आर मोस्टली म्यालिग्नेन्ट ट्युमरै हुन्छ हैन. अनि यसमा यो कन्जेनाइटल एड्रिनल हाइपरप्लेसिया भनेको चाहिँ एउटा अटोजोमल रिसेसिभ कन्डिसन हो. यसमा चाहिँ 21 हाइड्रोक्सिलेज इन्जाइमको डेफिसिएन्ट हुन्छ. यो इन्जाइम डेफिसिएन्ट हुने बित्तिकै के हुन्छ त भन्दाखेरि कर्टिसोलको प्रोडक्सन घट्छ र कम्पेन्सेटरी इन्क्रिज इन एसिटिएच हुन्छ है. एसिटिएच चाहिँ बढ्छ. कर्टिसोल घट्यो, कर्टिसोल घटिसकेपछि के हुन्छ, यसमा चाहिँ बोथ द कर्टिसोल र मिनरल कर्टिकोइड बिस्तारै यसको सिन्थेसिस डेफिसिएन्ट हुन थाल्छ. डेफिसिएन्ट भएपछि all the mechanism is shifted towards the synthesis of steroid, sex steroid hormone. Okay, र त्यसले गर्दाखेरि एड्रिनल ग्ल्यान्ड्सहरु बाइलेटरली हाइपरप्लास्टिक इन्लार्ज हुन्छ नि त हैन. हाइपरट्रोफी हाइपरप्लेजिया पढाछ नि है. त्यस्तै गरी यसमा चाहिँ एड्रिनल कर्टेक्स थिकेन नोडुलो हुन्छ. जनरली येलोइश हुनुपर्ने एड्रिनल कर्टेक्स ब्राउनिश हुन्छ ड्यू टु द डिप्लिसन अफ लिपिड. र यसमा जसरी एड्रिनल ग्ल्यान्डहरुको साइज इन्क्रिज हुन्छ, नम्बर इन्क्रिज हुन्छ हैन, सेल्सको नम्बर इन्क्रिज हुन्छ, त्यस्तै गरी एसिटिएस प्रोड्युसिङ सेल्स इन द पिट्युटरी इज अल्सो इन्क्रिज हुन सक्छ भन्न खोजेको के. एन्ड female may present with the symptoms of masculinization as clitoral hypertrophy हुन सक्छ. She may even present with hirsutism, acne, oligomenorrhea हैन, and ambiguous genitalia, जस्तै जेनिटलिया छुटिन नसक्ने, is the most features seen in the infant, or pseudohermaphroditism भनेर उनीहरू इन्फान्टमा चाहिँ देखिन सक्छ. लाइकवाइज मेलमा चाहिँ प्रिकसियस प्युबर्टी, सर्टेन एज पछि प्युबर्टल एज स्टार्ट हुनु अगाडि नै दे बिकम मच्योर, के अरे दारी जुङ्गा आउन सक्ने होइन, अनि इभन दे मे बी इन्फर्टाइल, यो सबै फिचर्सहरू आउन सक्छ. सो ड्यू टु द डेफिसियन्सी अफ एल्डोस्टेरोन एन्ड द कर्टिसोल, एल्डोस्टेरोन डेफिसियन्ट भएर सल्ट वेस्टिङ अर द सोडियम लस हुन सक्छ भने ग्लुकोकर्टिकोइड अर द कर्टिसोल डेफिसियन्ट भएर एड्रिनल क्राइसिस पनि हुन सक्छ भन्न खोजेको के. एन्ड बेस्ट ट्रिटमेन्ट चाहिँ के हुन्छ, सप्लिमेन्टेसन अफ ग्लुकोकर्टिकोइड्स एन्ड मिनरल कर्टिकोइड. ग्लुकोकर्टिकोइड दियो भने कर्टिसोल लेभल बढ्छ र इन्क्रिज भएको एसिटिएसलाई सप्रेस गरिदिन्छ. अनि मिनरल कर्टिकोइड सप्लिमेन्टेसन गर्यो भने के हुन्छ, फर दि सल्ट वेस्टिङ भेरिएन्ट, किनभने सल्ट वेस्ट भइरहेछ होइन, सोडियम युरिनमा लस भइरहेछ भने के हुन्छ, हाइपोटेन्सन हुन सक्छ होइन. अनि त्यसपछि अर्को के हुन्छ, डिहाइड्रेसन हुन सक्छ, किन अलङ विथ द सोडियम वाटर पनि लस हुन्छ, पोटासियम हाइपरक्यालेमिया हुन्छ, पोटासियम चाहिँ रिटेन भइरहेछ बडीमा. त्यही भएर चाहिँ बोथ द ग्लुकोकर्टिकोइड एन्ड द मिनरल कर्टिकोइड शुड बी सप्लिमेन्टेड. बुझ्यो अब?
Yes, ma'am. Thank you, ma'am.
ओके, अब एडिसन्स डिजिज स्टार्ट गर्ने. Okay, coming to the Addison's disease. This is an adrenocortical insufficiency, primary and chronic. Acute किन होइन, किनभने यसमा सिम्पटम्स आउन प्रोलङ पिरियड अफ टाइम लाग्छ. अक्युट भनेको जस्तै वाटरहाउस फ्रेडरिसन सिन्ड्रोम, मेनिन्जाइटिसमा हुने होइन, अनि त्यसै एड्रिनल क्राइसिस, प्राइमरी एड्रिनल क्राइसिसहरू चाहिँ यो वाटरहाउस फ्रेडरिसन सिन्ड्रोम, मेनिन्जाइटिसहरूबाट हुने कन्डिसन हुन्छ. तर दिस वान इज अ क्रोनिक कन्डिसन. There is a destruction of the adrenal cortex progressively. एकैचोटि हुँदैन, बिस्तारै हुँदै हुँदै अल्टिमेटली एड्रिनल कर्टेक्सहरू सबै डिस्ट्रोय हुन्छ. र इन केस अफ द एडिसन्स डिजिज, more than 90% of the adrenal cortex destruction should be seen for the manifestation of clinical features. अनि यसमा चाहिँ any sex and race are equally affected. एडिसन्स डिजिज उता चाहिँ के थियो, कुसिङ सिन्ड्रोममा चाहिँ एक्सेस अफ द हर्मोन थियो होइन, भनेपछि यसमा चाहिँ हर्मोनल इन्सफिसियन्सी हुन्छ, एड्रिनोकर्टिकल हर्मोनको इन्सफिसियन्सी हुन्छ. उता चाहिँ एक्सेस थियो भने यता इन्सफिसियन्ट हुन्छ. एन्ड मोर देन 90% अफ द एड्रिनोकर्टेक्स शुड बी डिस्ट्रोयड. एन्ड एनी अफ द सेक्स एन्ड रेस क्यान बी अफेक्टेड. ओके, मोस्ट कमन कजहरू अटो इम्युन एड्रिनलाइटिस, autoimmune condition हुन सक्छ, or there may be any infection हुन सक्छ, or there may be the metastasis of a tumor from any other site that may metastasize to adrenal gland हुन सक्छ, or any genetic disorder हुन सक्छ. जुनसुकै कन्डिसनले पनि एडिसन्स डिजिज हुन सक्छ है. एउटा चाहिँ अटोइम्युन, अर्को इन्फेक्सन, अर्को मेटास्टेटिक क्यान्सर र जेनेटिक डिसअर्डर्स. अटोइम्युन एड्रिनलाइटिसले चाहिँ के गर्छ त भन्दाखेरि यो चाहिँ इट इज द मोस्ट कमन कज अफ एडिसन्स डिजिज. ओके, अनि यसमा चाहिँ के हुन्छ त भन्दाखेरि देयर मे बी द यो स्टेरोइडोजेनिक सेल्सहरू होइन, कर्टिसोलहरू प्रड्युस गर्ने सेल्सको चाहिँ अटोइम्युन बडीको अटोइम्युनले नै अटोइम्युनिटीले नै डिस्ट्रोय गर्न सक्छ है. या अटो एन्टिबडिज अगेन्स्ट द इन्जाइम 17 हाइड्रोक्सिलेज, 21 हाइड्रोक्सिलेज इन्जाइमको अगेन्स्टमा अटो एन्टिबडिजहरू बन्यो भने. ओके, सो यो चाहिँ जेसँग पनि एसोसिएसन हुन सक्छ. आइदर इट मे बी रेस्ट्रिक्टेड टु ओन्ली द एड्रिनल ग्ल्यान्ड, or it may be associated with various autoimmune disorders that Hashimoto thyroiditis, diabetes mellitus type 1. यसमा चाहिँ एड्रिनोकर्टिकल इन्सफिसियन्सी हुन्छ. मोस्ट कमन कज इज अटोइम्युन एड्रिनलाइटिस, जसमा चाहिँ यो सबै कर्टिसोल सेक्रेट गर्ने सेल्सहरूको अटोइम्युन डिस्ट्रक्सन हुन सक्छ, या अटो एन्टिबडिज चाहिँ त्यो इन्जाइम्सहरू हुन्छ नि 17 हाइड्रोक्सिलेज र 21 हाइड्रोक्सिलेजको अगेन्स्टमा प्रड्युस हुन सक्छ. And in coming to the infection, it may be either TB or there may be the infection in the genitourinary tract or in the lungs. Similarly, due to fungal infection caused by histoplasma and coccidioides immitis, and or in the patient with AIDS, there may be what happened. There may be the presence of infection due to cytomegalovirus and Mycobacterium avium intracellularly. All these may also play a role in Addison's disease. Okay, एउटा चाहिँ autoimmune adrenalitis हुन्छ, अर्को infection हुन्छ, अर्को metastatic neoplasm of any site, either lung, breast, GI, blood cancers, metastatic neoplasm of any site भयो भने पनि this can lead to Addison's disease. Okay, and another is genetic disorder as congenital adrenal hyperplasia or adrenoleukodystrophy. यो दुईटा कन्डिसनमा चाहिँ जेनेटिकली पनि एड्रिनल इन्सफिसियन्सी हुन्छ है, त्यस्तो धेरै डिटेल चाहिँदैन, नाम मात्र सम्झे पुग्छ। सो एडिसन्स डिजिजमा के हुन्छ, अघि भने जस्तै हाइपोथालमसले कर्टिकोट्रोपिन रिलिजिङ हर्मोन रिलिज गर्छ, यसले एन्टेरियर पिट्युटरीमा एक्ट गरेर एसिटिएस बढाउँछ र यो एसिटिएस ले चाहिँ एड्रिनल ग्ल्यान्डमा एक्ट गर्छ हैन। तर यहाँ चाहिँ के हुन्छ त भन्दाखेरि यदि एड्रिनल ग्ल्यान्डै डिस्ट्रोय भयो, यदि कुनै पनि फंगल इन्फेक्सन मेटास्टेटिक ट्युमर्सहरुले गर्दाखेरि कर्टिसोल लेभल त लो हुने भयो। दिस कर्टिसोल लेभल will send a negative feedback mechanism, okay, to the anterior pituitary and to the hypothalamus. ACTS मात्र बढ्ने हुन्छ, अरु हार्मोन CRS हरु सबै लो हुन्छ र यसले सप्रेस गर्न सक्दैन। कर्टिसोल लेभलै लो भएपछि यसले चाहिँ नेगेटिभ यसले चाहिँ हाइपोथालमसले चाहिँ सप्रेस गर्न सक्दैन हैन, त्यही भएर चाहिँ एडिसन्स डिजिज हुन्छ। Okay, and the features appear only when 90% of the adrenal cortex is destroyed. So the patient may have weight loss, lethargy, hyperpigmentation due to the overactivity of melanocyte, as there is a ACTS चाहिँ body नै हुन्छ नि त, so that exposed area मा चाहिँ pigmentation धेरै देखिन सक्छ। Even the patient may present with the anorexia, loss of appetite, vomiting, and यसमा चाहिँ एड्रिनोकोर्टिकल इन्सफिसियन्सी भएको हुनाले एन्ड्रोजन हार्मोन पनि कम हुन्छ। एन्ड्रोजन हार्मोन कम भएपछि इभन द पेशेन्ट मे प्रेजेन्ट विथ बाल्डनेस, ओके। र मिनरल कर्टिकोइड त्यस्तै गरी मिनरल कर्टिकोइड कम भएर चाहिँ के हुन्छ, मिनरल कर्टिकोइडले त सोडियमको रिटेन्सन, वाटर रिटेन्सन र पोटासियम एक्सक्रिसन गराउने हो नि त हैन। तर जब मिनरल कर्टिकोइडै लेस भएपछि चाहिँ के हुन्छ भन्दा सोडियम लस हुन्छ। सोडियम लस भएपछि हाइपोटेन्सन हुन्छ, पोटासियम बडीमा रिटेन भएपछि हाइपरक्यालेमिया हुन्छ, ओके। सोडियमसँग वाटर पनि लस हुने हुनाले भोल्युम डिप्लिसन हुन्छ। त्यस्तै गरी ग्लुकोकर्टिकोइड डेफिसिएन्ट भएपछि के हुन्छ, हाइपोग्लाइसेमिया हुन्छ, ओके। एन्ड बायोकेमिकल्ली देयर इज हाइपरक्यालेमिया, किन भन्दाखेरि यसमा चाहिँ पोटासियम रिटेन्सन भइराछ, हाइपोनेट्रिमिया, अनि त्यसपछि भोल्युम डिप्लिसन रिजल्टिङ इन लो GFR. Even any of this stressful condition may lead to adrenal crisis, okay. जस्तै इन्फेक्सन भयो, ट्रमा भयो, सर्जरी भयो भने यसले पनि यो एड्रिनल क्राइसिसलाई चाहिँ प्रिसिपिटेट गर्छ। अनि त्यसपछि पेशेन्ट विल ह्याभ भमिटिङ, कोमा, हाइपोटेन्सन, इभन कोल्याप्स हुन सक्छ र डेथ पनि हुन सक्छ हार्मोनल डिप्लिसनले गर्दाखेरि है। लाइक दिस स्किन पिगमेन्टेसन, hypoglycemia, hypotension, weight loss, GI disturbances, renal shutdown, अनि यसमा चाहिँ के हुन्छ त भन्दाखेरि हार्मोनल डिफिसिएन्ट भएपछि सोडियम र वाटर लस, पोटासियम बडीमा रिटेन हुन्छ। सो morphologically, in case of, as we know, the most common cause is the autoimmune adrenalitis. What happens is that the glands become shrunken morphologically, and we can't identify the adrenal gland situated over the suprarenal region, okay. And histologically there is a very residual scattered cortical cells only seen. A TB or fungal infection ma ke huncha, we may see the granulomatous reactions as well. Ani metastatic carcinoma ma, the normal architecture of the adrenal may be obscured by the infiltrating tumor. Okay, the infiltrating tumor may be seen in crossing towards the normal glands or the normal architecture of adrenals. बुझ्यो एडिसन्स डिजिज के बुझेन
बुझेन
सबैले बुझ्यो बुझ्यो
Yes, ma'am.
Okay, this much for today. Okay.
Thank you, ma'am.
Okay, म यो प्रेजेन्टेसन पछि पठाइदिन्छु ल हिजो जस्तै म मिलनकै उसमा पठाइदिन्छु है Okay, bye bye.